In this video, we will learn more about how to take misoprostol correctly and what to expect. In many countries, there are restrictions on access to abortion, and Rose's only option was to use the drug misoprostol by itself. It is used to treat other conditions and is often widely available. Rose was able to purchase this in a pharmacy without a prescription. Using misoprostol is a safe and effective way to end a pregnancy, providing you have the right information about how to use the pills. And remember, you should only proceed with an abortion at home if you believe you are less than 12 weeks pregnant. As Rose will show us, before you start the process, make sure you are in a comfortable location where you can lie down. Make sure that you have sanitary pads, and ideally, someone who can support you, such as a friend, partner, or relative. You will be able to eat lightly and drink. It is also a good idea to be close to a toilet and have a health facility or helpline you can contact if you experience any complications. Complications are very unlikely, but if you do have a problem, remember, you can say that you are having a miscarriage. The doctor will not know that you have taken misoprostol pills. Once you are ready, check that your pills are 200 micrograms each. If yes, then the best option is to insert 4 of them into your vagina by pushing them up with your finger as far as is comfortable and leave them inside. This is the easiest method and has the lowest side effects. However, the pills may stay in the vagina for 2 to 3 days. If you are examined by a provider during the time period, in case of complications, the pills, or what remains of the pills, will be visible during vaginal inspection, and the provider will know you have used them, which could cause you problems if abortion is restricted in your country. If this is a worry, place the 4 pills under your tongue and let them dissolve gradually instead. Do not eat or drink anything, or swallow the pills for 30 minutes. After 30 minutes, you can sip some water and swallow what's left of the pills. If you vomit before 30 minutes, you will need to put new pills under your tongue. But if you vomit after this, don't worry, as all the pills will have been absorbed. If you have inserted them into your vagina, this is not relevant. Next, wait 3 hours and then repeat exactly the same process, either inserting 4 pills into your vagina or putting the pills under your tongue. Bleeding and cramping should start within 3 to 4 hours of taking the first 4 pills. Don't worry, this is a sign that the pills are working. If, like Rose, you're under 10 weeks, and if bleeding and cramping have started after 2 doses of 4 pills, then you don't need to take any more. However, if you are between 10 and 12 weeks pregnant, or you have not started bleeding, you should take another dose of 4 pills, up to 12 pills in total. If nothing happens after 3 doses, you will need to visit a health provider, as there may be a medical reason that it has not worked. You will experience bleeding and cramping, and although the process can be painful or difficult, try not to worry. This is all a sign that the pills are working. Other normal side effects can be a fever, chills, diarrhea, or vomiting. Every woman will have a unique experience, so you may not experience all of these things. For some women, it will feel similar to a normal menstrual period. For others, the bleeding will be heavier, or the cramping may be more painful or come in waves. You will see clots and pieces of whitish tissue in the blood. This is no cause for alarm, and you can take ibuprofen 400 to 600 milligrams or diclofenac sodium 50 milligrams before you begin, and then every 8 hours to manage the pain. The whole process should take 1 to 2 days and will vary from woman to woman. Be sure to leave yourself adequate time to manage the process safely and in private if you need to. Many women experience discharge from the vagina when the bleeding subsides. Slight bloody discharge is common as bleeding slows, which may be yellow or brown and may have a sour smell. There may also be lighter bleeding for 1 to 2 weeks or even longer after it's done. This shouldn't interrupt your daily activities. There's a lot of information to take in here, but remember, every woman will have a different experience. So please, watch our next video that highlights how to know and what to do if something seems wrong.